My name is Matthew Gamble. I'm the Vice President of Operations at Theory Wellness in Bridgewater, Massachusetts. I'd like to start by thanking you for giving us the opportunity to provide feedback and guidance on the future developments of legalized cannabis in Massachusetts. The topic I would like to provide input today on is the standards for lab testing, how they relate to the dosing of cannabinoids in medical or marijuana products. The process a manufacturer must follow to produce a marijuana product involves creating or procuring a cannabis extract and using that extract to titrate cannabinoids into a product recipe. The cannabis extract is tested by an approved laboratory, then an appropriate amount of oil is calculated and added to the batch to produce the desired cannabinoid level. The finished marijuana product is then sent to an approved lab to again be tested for cannabinoids. Current regulations allow for a maximum dose of 5 milligrams of THC per individual serving of marijuana product, but due to the practical limitations of laboratory testing, this is an impossible limit to achieve on a consistent basis. The testing methodologies allow for up to a 20% variance of recovery versus a nominal cannabinoid preparation. This means a test for any specific cannabinoid could be under or overstated by up to 20%, while still falling within an acceptable range. This variance can be compounded because both the cannabis extract and the final marijuana product are subject to the same variance. Current regulations, however, do not allow for any variance above the 5 milligram limit. Due to the irreversible nature of creating a marijuana product, there is far too much risk for a product manufacturer to allow the variance to potentially return a result above the 5 milligram limit, so the effective dosing limit is below what is intended. Our suggestion is to allow for an acceptable variance range of titration for all marijuana products to account for the variable nature of cannabinoid testing. We suggest that a 15% variance be permitted for marijuana product dose limits. This mirrors the standard acceptable range designated by the USB for the manufacturing of pharmaceuticals and would account for nearly all cases of variance in the lab testing methodologies. Thank you.
Thank you very much, Matt. I think I've already got it. You gave and we did already. Next speaker I have is Grant Ellis. Good afternoon, Grant. How are you?
Hi, Chairman Hoffman. Thank you very
Well, thanks.
Good afternoon to the Commission, and thank you for affording me this opportunity to speak today. I myself am disabled and, for the most part, homebound medical patient. I was 26 years old and a graduate student at Boston College, 4 years into a postdoctorate degree studying a quantitative methodology to examine the cogency of public discourse in the context of the backroom deliberations of lawmakers and regulators. So, unfortunately, overnight in May of 2014, my throat began collapsing and my esophagus and airway began penetrating into each other. It affects nerves going into my face and my eye, and so I can't see very well and my face always hurts. In any event, I went through a painstaking 18-month process of hospitalizations, inpatient experiences, and general hell. By the end of that, I was on such a litany of medications that I can't even list them all. But anyway, about 18 months in, one of my doctors realized that things weren't going to get better, and they recommended that I try to use medical cannabis as a way to supplement some of the pharmanarcotics that they were prescribing. And with medical cannabis, over about 6 months, I was able to reduce that dosage by almost a third. And that had a big impact, not only in terms of my quality of life, but also in terms of not being constantly dizzy from the narcotic medications. In any event, because I'm so limited in my mobility, I'm dependent on cannabis caregiver services, and I'm also on Social Security disability. I don't use dispensaries because not only are the fees for delivery exorbitantly high, but some of the menu prices are also exorbitantly high. One dispensary wanted to charge me 40% of my SSDI stipend for 1 month just to get 1 ounce of flour, which is what I consume over the course of a month. And that's just impractical. I would have no ability to get an Uber to my doctor if I were spending that much on my cannabis each month. So I rely on small mom and pop caregiver operations, and I do so because one, they do not charge me a delivery fee. The one I use now waives delivery fees for disabled and homebound patients. Never seen a dispensary do that. And the second is they only charge about $200 per ounce, which is almost a 75% decrease from the retail price of dispensaries. And I think it's imperative that the Commission takes steps to not only protect these caregivers in law who are helping patients like myself that barely have any say in this process due to our physical limitations, but also to expand those protections for caregivers. I heard mentioned earlier the ratio of caregiver to patient. Currently, it's hard for me to even find a caregiver because they're forced to work within the confines of this one-to-one limit. And so when I lose a caregiver, it can take me 3 to 4 weeks to find another one, during which I'm using a lower dose of medication than I would be otherwise, and I don't have access to cannabis at a price I can afford. So I implore the Commission to allow these caregivers to operate with effective regulatory oversight that gives them an expanded number of patients per caregiver, that allows them to operate in collectives, that allows them to register with the Commission on an expedited basis without any of the procedural hurdles facing other applicants. These are not moneyed groups. They're small mom and pop operations trying to help patients, especially homebound patients, and they should be given some kind of carve out in the law to enable them to more seamlessly provide those services. Beyond that, the type of care that I receive from a caregiver is not just a commercial sale. Every caregiver I've ever had has come into my home, talked with me about my conditions, and helped me find medication that best serves my needs. And I think it is imperative that the Commission put a focus on that kind of holistic interaction rather than just looking at the commercial and tax elements of the law. I understand it's important. I'm just begging the Commission not to forget the knock-on impact that can happen to patients like myself when these small operations are pushed out of the market due to onerous regulatory burdens. So I appreciate the time of the Commission today, and I would also just leave one final note that the Commission should continue to liaise with the legislature to ensure that the 3% cap on community host agreements is enforced strictly, because to do otherwise further limits access to the market for these small businesses, and thus means there's less competition and higher prices for patients like myself. So thank you.
Next speaker is Ethan Vogt. How are you, Ethan?
I'm great, thank you. My name is Ethan Vogt. I'm a resident of Roxbury and a founder of Homegrown Boston, which is an arts organization that operates in the cannabis space. I want to thank you for this opportunity to give testimony, and really thank you for the service that you guys have taken on to the Commonwealth. I hope that over the last 2 years you guys have met a lot of the cannabis community. You've seen that we're educators, that we're farmers, that we're business leaders, we're artists, we're healers. And I imagine you've visited other states and probably have more experience than some people in this room in seeing how the operations, or how it rolls out, and how it tends to pretty much function, is my understanding. I hope you've tried a CBD tincture at one point too, and yourself kind of understood that this is not something to be too afraid of. So I think what I want to talk about today is I feel like as recreation opens and spreads, that social use and social consumption is of great is of great benefit. We have this community that you guys have met that has great expertise, that has great compassion, and we cannot be a service to the general public if there aren't spaces in which we can engage with them. So I think nobody would agree that eating an edible at home is the best way for somebody to be introduced to cannabis. That if there were spaces permitted, that we could reduce the stigma. We could go, people could bring their grandmother to try it among. I'm literally talking about, like, I think there's a lot of interest out here, and we're impaired by not being able to do this. So I want to talk about kind of 3 points that I want to make towards social consumption. The the first recommendation I have is for you guys to, and I know this is ongoing and these are really responding to what I've heard from you guys as concerns about social consumption, which is to define smoking, and define smoking very carefully, because we're very flexible to work around regulations, and nobody wants people to be subjected to secondhand smoke if they don't want to, et cetera, et cetera. But if smoking was defined as the combustion of the herb with fire that we know has some concerns around carcinogens, if it was defined very specifically, and then vaping or other methods of consuming was allowed, then that would give us some flexibility. I don't support going to an all edible social consumption space. I just think it's really unpredictable and really probably the worst way for somebody to start. My second proposal is for DUI is an issue with any intoxicating substance. I think let's manage it together. Let's come up with, okay, let's try to either work with ride shares. Let's have social consumption clubs near the T or something like that. So let's sensible regulations around DUI. Nobody wants to get in accidents. And then my final point is, let's look at social clubs and whether whether we can work within the existing laws to allow for some sense of community gathering and educating and prototyping what a social consumption space would look like. I know people have mentioned the Summit Lounge and the work that they've done out in Worcester, and it's an organization I very much support. But I think even them are kind of in a gray area, and there is no movement, as far as I can tell, in Boston to this, which is an organization I would proudly be a member. Then I guess I would finally say, with my 1 minute left, I'm concerned that the social consumption is being delayed for political reasons, and that there are politicians that are uncomfortable with this. And I ask you to not protect the politicians, and to move forward with policies. And if the politicians have a problem with it, at least, or we can have an open debate and the voters can respond to them. So I know you have hard work to do, and I look forward to the upcoming regulations and helping in any way I can.
Thank you, Ethan.
Excuse me, I have a point of order. Am I on the list?
Um,
Because I signed up like way before a lot of those people. I was here at 10:45.
Okay, I think I've covered. What's your name?
Anna Mead, M-E-A-D-E. I was here at 10:45.
Give me a second.
Okay, I don't mind to wait, but I might have signed up on the wrong list. Sorry to delay.
I do not see your name on the list. Is there another one outside?
I just signed up on the new list out there. I signed up at 10:45.
Well, I will get you, I promise you. I'm just going in the sequence I've got things on.
Okay.
Sorry, I'm not able to do anything else. We're not going to finish until everyone's had a chance to speak. Next speaker, Michael Kahn.
Good afternoon. Can everybody hear me? Yeah. Okay. My name is Michael Kahn. I'm a minority partner in Instagreen and also founding partner in Combination, which is the parent company of Dabus. The Dabus is a concept that would like to be a social lounge. Very good follow-up to Ethan. Basically, we've spent the past 6 months gathering info regarding starting a recreational consumption on premises facility in Springfield. However, we're running into a lot of silence from you guys as far as where the next steps are. Basically, we've been told to come to these meetings and tell you guys what we would like to see. So we're asking the Commission to do a better job in engaging the public on this social consumption discussion, and also open the application process so we can start preparing the application and shift our focus to operations and satisfying those regulations. We see a lot of challenges in the consumption on premises field, and we'd appreciate an opportunity to present specific suggestions to be considered in drafting the policy. I'm going to present a couple questions that we don't need answers to, but just things to consider. Will consumption on premises be required to purchase wholesale, or can they grow their own?
I just moved over one because we're using that to testify. Thanks, sorry for that.
That's okay. So will consumption on premises be required to purchase wholesale, or can they grow their own supply? Can members of the lounge take cannabis off premises after they have consumed and want to go on with their lives? Can we offer devices that allow members to take flower and process that into their own concentrates? Part of our business model includes transportation, so we also would like to understand if we can partition sections of the vehicle to allow the passengers to consume cannabis within the partitioned vehicle, separating the driver. We have a lot of questions and not a lot of answers here, and we've got a couple things that we would like to touch on. I mean, our business would cover education, medical consulting, transportation, a recreational lounge space, delivery, dispensary, extraction labs, testing facilities, tourism, bed and breakfast, and special events. And we're just waiting for you guys to give us an idea of where that can go. We've also considered a viable solution to the supply issue, which we'd like to have on record and consider possibly being a pilot program for this. Currently in Massachusetts, one-member households are allowed to grow 6 plants. If they have 2 members, they can grow 12. I'm under the impression that's way more than someone's going to use in a year. So I think we could create a framework for an outlet for these folks. Currently, they don't have a way to do anything other than give it away. So what we would like to do is create a framework where we can test the cannabis and approve it. And if it's approved based on the regulations that's set forth, we can take it on consignment and provide it as a product. And then from that, the person who provided the cannabis can either get revenue or have a tax benefit when it comes time to pay taxes. This would solve the oversupply problem, which also leads to the gray market problem, where you have cannabis available for lower prices on the gray market than it is in the legal market. So I think it creates an outlet for that, where we can also have a supply, and it also allows citizens to participate in this industry. So, I'd like to ask that you guys find ways to incorporate us in the conversation, because I think that there's a lot of individuals that can contribute thoughts, and we're on standby. We're ready. Like we own 4 VW buses. We've already looked at locations to do this thing. We have a website, social media, and we just want you guys to say how to do it. So, thank you for your time, and we look forward to working together.
Thank you, Michael.
Give you guys some of my cards.
Thank you. Next speaker is Jeff Rose. Let me see Jeff. Is he here? I'm back. I'm sorry, I messed his name up. I'm just almost Eric. Tunin. I apologize if I
pretty close.
Cedric, you need a chair. Oh, I'm sorry.
I misunderstood.
You're not sitting, you're not moving either.
No.
I think that works fine. Have a seat, Cedric.
No, I think yeah.
I'm sorry, Eric. How about I butcher your last name?
My last name is Hiltonen.
Oh,
I'm actually a former high school teacher, and I can tell you I've heard far worse versions of my name. I'm a resident of Lexington, and I'm also the Chief Operating Officer for a new business called King Green Industries.
I'm sorry?
I am the Chief Operating Officer for a new business called King Green Industries. We're just getting started in this process. And one of the things that we're looking at is delivery. And I've read some about different states that have different regulations and how those regulations impact the market. In particular, I just want to, well, first of all, I want you to be, just as you're making your decisions about the delivery system and the delivery service regulations, keep in mind how these will impact the business. I've read about regulations in other states where drivers are required to return back to their home office or the dispensary between deliveries. For a delivery system, it seems like that would be very onerous. Allow us to deliver to any location. As a resident of Lexington, there's a town-wide ban on recreational sales. It would be nice for me, even if we don't do the delivery system, it would be nice for me to be able to order from home. And also be aware of the security requirements for vehicles. Having things like armored cars may be a little bit onerous as well for small local businesses looking to get into this industry. So thank you for your time. Thank you for your consideration. I appreciate the work that you do.
Thank you. Next speaker is Brandon Pollock.
Good afternoon.
How are you?
I am well. How are you?
Fine, thanks.
So thank you all for your attention and listening to everyone today. Thank you for the audience for your commentary. It's been great to hear. My name is Brandon Pollock. I'm the CEO of Theory Wellness. We're a licensed marijuana retailer, provisionally licensed cultivator, manufacturer. We've been doing medical for a couple of years as well in Massachusetts. So we have a couple more focus points on the regulations. First is relating to agent registrations. Currently it's written as we have to register agents for every license type, including medical versus adult use. We're projecting, based on our licensing track, by the end of the year, myself and other key members of our team would have to have over 10 individual cards. These all have unique expiration dates. They have to be renewed annually, and it's a real heavy burden on the admin for us, and I imagine for the state as well. So we'd recommend single registration per company. We can track internally which agents are allowed access at which facility, but we think that would be a good improvement for the industry in general. Second point is in respect to 500-144, which is the limitation on sales. The way this is written allows a customer to go into a dispensary and purchase up to an ounce per transaction. This has gotten some people in Colorado in serious problems where a transaction could occur multiple times per day and then a customer could have over an ounce of cannabis on them. You could cycle through a dispensary technically unlimited times with the way this rule is written. So internally at our company we allow only an ounce per day, but our biggest fear is non-compliance or issues from other operators in some ways. So I would strongly recommend you look at limiting the amount a customer can purchase at a dispensary per day, not per transaction. Along this exact same regulation as well, right now the guidance allows a customer to purchase up to an ounce of flower or 5 grams of concentrate per transaction or maybe per day. It doesn't mention anything about infused products. There's also no guidance on how infused products should be tracked. Under the medical program, there's very clear mathematics that underline how much concentrate goes into a product and how much of those products you can sell. So myself, other operators, we're operating under medical guidance right now, but there's no adult use guidance on how to limit the sales on edible products. Last area of improvement is more towards just positioning ourselves to be competitive in the industry as a state. We think there's a couple areas around marketing and advertising that are overly burdensome. First, for example, I'll just show you folks this. This is an example of everything we'd have to put on an advertisement right now. What happens is this has just become extremely fine, small font at the bottom of, say, a billboard or a newspaper advertisement, and consumers are gonna end up they're gonna glaze over it. I'd recommend trying to streamline the warnings that you have to put on all your marketing collateral to make it a little more efficient and really highlight the key points that the state is trying to have consumers read. This is it's a little too much, and it's just going to create a lot of really small font that doesn't accomplish much, in my opinion. Lastly, along marketing and advertising, we're looking for clarity on promotional materials. Ideally, we'd be allowed to sell lighters, hats, t-shirts with our logo on it. Cannabis is a safer substance than alcohol. If I go into a brewery, I can buy a hat that has the brewery's name on it. I should be able to do the same for our company and other retailers as well. I think that'll help build brands here in Massachusetts that can be national leaders. As other states in New England and the East Coast legalize cannabis, it'll be good for us to have our name recognition out there through marketing, collateral, and promotional items like that. And it's just not clear right now if we can do that. So, thank you.
Thank you, Brandon. Next speaker is Sydney Griffin.